Our other top story, fentanyl, a powerful and dangerous drug, is now the leading cause of overdose deaths right here in Utah.
A new state report details the devastating impacts this drug is having on our communities. News specialist Shara Park is digging into it. And Shara, these numbers are so concerning.
Yeah, Deanie and Dan, they really are, especially when you remember that these numbers, they're people. They're our family, friends, and vulnerable members of our community. Now, this new report from the Utah Department of Health and Human Services looked at a decade of overdose data starting in 2014 and found that the highest number of deaths on record occurred in 2023. That year, 606 Utahns died of a drug overdose, and fentanyl was involved in nearly half of their deaths.
Between 2019 and 2020, we double the number of fentanyl deaths. And then we've just seen these significant year-over-year increases ever since.
Megan Brockmeyer led the research team and found that Utah had more than a 1,000% increase in deaths involving fentanyl over the last decade, making it the deadliest drug in our state. The areas with the highest rate of overdose deaths are Southeast and Tri-County health districts. Those are families living in Carbon, Emery, and Grand counties, as well as Daggett, Duchesne, and Uinta.
These are people's lives. And it's so, the impact doesn't just stay in that family, but it spreads, to community members and friends. And, there's a huge network of people that are impacted by the death of that person.
So why do we get a report like this? Well, this report tells state leaders where they need to focus drug education and prevention, as well as treatment services. To read the full report, you can visit our website, ksltv.com. Dan?
Yeah, very disturbing report there. Thanks a lot, Shara.